The
medical student.
which medical student?
First year.
First year medical student. Okay, and teach him and check his understanding. So that means, what is the station? What is the station about? What are the genes he's checking here?
How well you know about BLS?
Are the genes he's checking whether you know how to do the BLS? No. What are they checking?
Communication skills.
Teaching is not teamwork. Teaching skills. Because in the mark sheet they always write teaching. They don't say BLS. They write it as teaching. That means what do you have to show here? Your teaching skills. What are the teaching skills? Do you have any skill? Do you need any skill for teaching? What is it? What are the skills? What are the teaching skills required? Tell me. Who should be a good? Who will be a good teacher? What are things? What are a good teacher?
Confidence.
Confidence, first of all.
Good knowledge.
Knowledge, good. What else?
Communication.
When will you have confidence? If you have a knowledge. If you have knowledge, you will have a big confidence. Okay. What else? Experience. Okay. Okay. Patience. Yeah. Sympathy.
I'm sorry if you're not.
Why patience? Why you would want to say patience?
Because when you're teaching, it can sometimes be frustrating because the other guy is not understanding it.
Because again, not
You have to
understanding.
repeat again and again.
Repeat again and again. Okay. Any other reason? Teachers get frustrated. Why tolerant? Why?
If the pay is not good.
Who can tailor his skills?
Sometimes people ask you such questions. Teacher get irritated. It can happen. So you should not show that irritation. Yeah. However much the students are asking whatever they're asking. So you need to have the patience, be tolerant. What else? Don't be boring. Okay. What else? Good. These are important. Don't be boring.
Check understanding everything.
Check understanding. Make sure that they understand what you say. What else?
It's one-to-one eye contact.
Eye contact. Okay.
It's simple.
The most important you are not yet told me. That's what I'm waiting for.
How to
Understand the
simplify.
psychology clean language.
Okay. What is the difference between a teacher and a student back home in our country and a teacher and a student here in this country? What is the difference? Sorry? Interactive. Okay. That means, yeah, that's the most important. Don't act like a boss. So friendly. The most important thing in the station is be friendly. If you're not going to be friendly with this person, like if you show our attitude back home, our teacher show to that student, you fail the station. Be very friendly, very friendly, very friendly, very friendly. That's the most important thing in the station if you need to pass. Remember, this is the biggest problem to pass the station. 70 to 80% of the people fail the station. Near 80% I've seen. And however much I see, I've seen every time. Very few people pass the station, and only 2 people I've seen so far getting 12 out of 12. Only 2 people. Most of them, they get 8 or 9, some people get, but most of them 4, 5, 6, that's all. And some people have got only 2, 3. Okay, so now the problem is I did not know, I thought we are going wrong somewhere in our teaching. So every time I ask people who get high score, I ask them, what did you do? What did you must have done something different than what you did. They said no. And recently also, just about a month ago also, somebody got 12 out of 12 this station. I couldn't believe that. What happened? How did you get that, 12 out of 12? So he said, this is, I did not do anything different. Whatever you taught, I did the same thing. What happened was, he because when he entered the station, he decided, okay, BLS, anyway, I'm going to fail. He had already given up the station. So, the medical student, he told there's a lady, the medical student, the lady, do you want to learn? And he went, the mannequin was there, he sat on the ground. Then she was standing there. Do you want to sit with me? I will show you. So both of them sitting together. Then he was teaching, that when you do that, you have to check the airway first. Then you have to check the breathing and everything. Breathing, look, listen, feel. So he told, first you need to check, look, listen, and feel for breathing and everything. Before breathing, you should not forget to check the airway. Why he said that? Because he forgot. Then he started. So he was doing all these things. The examiner was laughing, the student was laughing. And he got 12. And he keeps coming here. Today also he is there as a mock examiner. I told him, you are a CPR consultant now. I gave that job. But you will see him in the mock test there. Okay, sir, but he did not do anything different than what we teach. Remember, the teaching quality, all the things what I told you is something very, very important. Be very friendly, explain in simple terms, and make sure he understands. These are very, very important. Now, what I'm going to do is I'm going to teach the whole the station first, how to do the CPR, how to do BLS, and then we will see what to do in the exam. Because it's something very long. You need to finish in 8 minutes time. Most of them, they can't finish in 8 minutes time. That's the reason, one reason people get a low score is they could not finish. Okay, but first let's see what to do, and then we'll see how to try to finish in 8 minutes time. So first remember, whom do you have to teach? Which student? First year. So why am I highlighting first year? Because he just joined the medical school. He joined. So, do you want to develop a good rapport with him?
Yeah.
Yes. How?
How he's doing?
How are you doing? How do you find the medical school? Interested? Do you find it interesting? Yeah, all these questions. So that's why it's start developing good rapport from the beginning. That's the reason I'm highlighting. Be friendly. Hello, I'm Dr. So-and-so. What's your name? I'm so-and-so. What do you say? Are you a medical student? How are you doing? Okay, so then ask at least 1 or 2 other questions. How do you find the medical school? So which student, which year? First year. First year. So how do you find the medical school? Are you enjoying? Do you find it interesting? So ask at least 2-3 questions. Then you ask, do you want to learn about CPR? Not CPR. What is that? BLS. Okay, wherever CPR, you need to change the BLS. Yeah. Do you want to learn about BLS? Oh yes. Before that, what do you need to do? Do you know what is BLS? Do you know? He has come for a workshop. You have organized a workshop, BLS workshop. Do you know? We are here. We are teaching BLS. Do you know anything about it? What is that? So what do you say?
Basic life.
This is a basic life support. This is a what is workshop. What is BLS? Okay, what is basic life support? This is what we do if somebody is as a cardiac arrest. Means if the heart is not working, this is what we do to make the heart work again. This is a life-saving procedure. Yeah, this is a life-saving skill which everyone should know. Even the non-medical people should know. Okay, if some emergencies happens, if somebody's heart is not beating, we do this thing. There's a basic life support to that is to make their heart work again. There's an emergency skill. There's a life-saving skill which everyone should know. So, do you want to know? Do you like to learn that? Oh, that's good. That's interesting. So then you say, okay, let me teach. Then you say, okay, teach him. Say, I will teach you on the mannequin here. All right? Okay. Now, let me explain to you, but then I'll see what to do in the exam. Yeah. First, imagine if the person is lying down somewhere. So whether in the hospital or maybe outside, yeah. Before you approach the patient, if he's lying somewhere, before you approach the patient, make sure the area is safe for you to approach. For example, imagine you see the person lying in the middle of the road. Don't go there and start doing a CPR. What can happen? After some time, somebody else may have to do CPR on you. So first you make sure the area is safe to approach. Or for example, imagine you see a man lying on the floor and the floor is wet. What can happen if you also go and stand on the wet floor?
Shock.
Why do you think he fallen there? Electrical shock. Maybe there's a live wire touching the water. You know the water is a good conductor of electricity. Maybe he is collapsed there because he got electric shock. Now you go try to save him, you also got a shock, both of them will be lying there together. Yeah, so you got to be very careful if the floor is wet. Okay, so maybe he himself got a shock. So what you're saying is, first of all, make sure the area safety approach. And if you think the patient is not in a safe area, first you move into the safe area. Like if he's in the middle of the road, yeah, but you can take him to the side of the road, the side of the route. Okay, so then, yeah, what do you do? Check his response. Gently shake his shoulder. Are you all right? Are you all right? Will you call his name?
No.
You don't even know his name. Yeah. So are you all right? Are you all right? Okay. And yeah, gently shake him. Gently shake him. Don't do too much shaking here. What can happen? If at all he is collapsed because of trauma, yeah, he can end up with spinal cord injury. So gently shake him. You don't need to say everything what I'm telling you. So this is what I'm trying to explain to you. For the candidate, for the medical student, you don't have to explain everything because you don't have time. So now turn the victim. First you check. Okay, are you all right? Right. If he's not responding, turn the victim on his back. If he's like that, yeah, don't make him lie on his back. On his back, yeah, there's a back. Lie on his back like that, and place your hand on his forehead and gently tilt his head back with your fingertips under the point of the victim's chin and lift the chin to open the airway. So what you're doing, first you need to check the airway. That's by doing head tilt and chin lift. What you're doing with the left hand, you keep your hand over the forehead, and with the right two fingers, index and middle finger, keep it under the chin, and you do a head tilt and lift the chin. Lift the chin like that, and that's how you open the airway. Okay, so what do you do? Tilt, lift the chin, open the mouth. Yeah, lift it, lift this one, open the mouth. Okay, here is a bit difficult with the mannequin here. Lift the chin, you do that. Say tilt, chin lift to open the airway. If there's any foreign body in the airway, remove it carefully without pushing it down to his throat. If you see anything in his mouth, then pull it out carefully. Don't push it deep into his mouth, yeah, when you're taking it out. And then look, listen, and feel for normal breathing for no more than 10 seconds. And check the carotid pulse at the same time. Okay, so first you check the airway, then you do the look, listen, and feeling for the normal breathing. Okay, how do you do that? So, check the carotid at the same time. So keep your chin near to the patient's mouth and check the chest movements while breathing, and listen to his breath sounds and feel for breathing hitting on your cheeks. Yeah, keep 2 fingers on his carotid pulse. What you do, you keep the head tilt in that same position and keep a chin near to the victim's mouth, and look at the chest for chest wall movement when they are breathing. And look, listen, can you hear the breath sounds and feel whether the breath is hitting onto your cheeks. And make sure the head is tilted, yeah. This should always be there, not like this, because then the airway can get obstructed again. So you know why the airway gets obstructed, yeah? Yes. Tongue can fall backwards. That's why I told you, already explained that, yeah. So you have to maintain that and keep look at the end of not this finger. Where do you keep this hand? Over the carotid pulse. You do the head tilt, but the fingers will be on the carotid pulse, yeah. So look, listen, and feel for breathing for 10 seconds, and at the same time keep checking the carotid pulse. Now, if the patient is not breathing, then call for help. If the patient is not breathing, call for help. And if you're in the hospital, you can call the cardiac arrest team. But if you're outside the hospital, you call the ambulance. Last time in the old exam, the CPR station used to come in the old exam. That time it was not teaching. That time the examiner wanted to see how you do the CPR. So the question used to say the patient collapsed in the hospital, do the CPR. So people here check the response, patient not responding, not breathing, they call the ambulance. What do you want the ambulance to do? Patient is collapsed in the hospital. You call the ambulance there, tell the ambulance over, take him from the hospital, you put him on the street now. So whom do you call if the patient collapsed in the hospital? Cardiac arrest team. And when do you call ambulance? Outside the hospital. And ask a helper to call if possible, otherwise call them yourself. Stay with the victim when making the call if possible. Why do you have to stay with the victim when you're making a call? Because usually this is actually for the non-medical people. If they don't know how to do CPR, if they are near the patient, the ambulance will explain to you how to do the CPR. Okay, so this is not for medical people. And send someone to get an AED if possible, automatic electric defibrillation, If possible, you can send someone. Then start the CPR or the BLS, change that. Start with the chest compression. Okay, now, so what I would advise is divide this into 3 parts, the BLS. The first part is checking and calling for help. What are the things you check? Check for the response, check the airway, check the breathing, patient not breathing, you are calling for help. That's the first part. Okay. The second part is chest compression. Now, what is CPR? Cardiopulmonary resuscitation. What is cardio? Chest compression. What is pulmonary? Giving rescue breaths. Okay. Which one you start with? The chest compression, then the rescue breath, or rescue breath first, then the chest compression. Why? In adult, yeah. In children, which one you do first? Rescue breath first, then you do chest compression. Why? Because the cardiac arrest in children is not mainly due to cardiac problem. It's due to respiratory arrest because the foreign body choking. Yeah, that's why they get a respiratory arrest first, which leads to cardiac arrest. That means in children you try to give the rescue breath first, because usually their heart is not, they don't have a problem in the heart. Because if you remove the foreign body, then everything will be fine. That's why you try rescue breath first. Whereas in adults, the cardiac arrest is mainly due to cardiac problem. So that's the reason chest compression is more important than rescue breath. So that's why you started the chest compression first in adults. Okay, so now you should teach him how to do the chest compression. Start with the chest compression. Kneel by the side of the victim. In the exam, the mannequin will be on the floor. So you kneel down, and also, can you kneel down to come here? You can sit with me here. Kneel down. Place the heel of one hand in the center of the victim's chest, which is the lower half of the victim's sternum. Okay, so keep the hand, heel of the hand, or the center of the center, yeah, and the lower part, of the victim's the sternum. Place the heel of your other hand on the top of the first hand. Interlock the fingers of your hands and ensure that the pressure is not applied over the victim's ribs. Anything wrong here?
No.
What is wrong? Yeah. So you interlocked, but the fingers are pressing the chest. The fingers should not be pressing the chest wall, because then that will cause rib fractures. So that means your fingers should be away from the chest wall. So interlock your fingers, keep your fingers away from the chest wall. That means only this part should be touching. Okay, and keep your arms straight, elbow locked. Okay, look at me. See if I'm doing it right.
No. You're using crutches.
From your back.
Good. What's wrong?
You have to keep the elbows
Straight and straight from your back.
Yes, what are you doing actually? You're doing exercise, yeah? Push up. This is push up. So you have to keep the elbow straight and locked. Okay, tell me if I'm okay now.
No.
What's wrong?
Your hands.
You should be straight like this, okay? Your shoulder should be straight onto the patient's. Your whole body weight you should use to compress. So keep your arms straight, elbow locked. Do not apply any pressure over the upper abdominal xiphoesternum, because xiphoesternum can break. So don't keep it on the tummy area. And position your shoulders vertically above the victim's chest and press down on the sternum. Depth of 5 to 6 centimeters. Yeah, keep your shoulders straight, victim's chest straight there, and press the chest about 5 to 6 centimeters. I want one of you to show me in your finger how much is 5 to 6 centimeters. How much?
About 2 inches.
In your finger. Don't show this. Which is better? Showing the finger itself. Okay? The little finger, almost the full length, not the full length, almost the full length. That is about 5 centimeters. Because last time somebody told me this much.
No, that's one.
That is just
That's
2.5 centimeter. That's 2.5, yeah. So almost here, or some, I would say almost the length of the little finger. Not the full length. That's about 5 to 6 centimeter. So it should go at least that depth. Okay. And after each compression, release all the pressure on the chest without losing contact between your hands and the sternum. Okay, so anything wrong here? Yes. You should not lose contact between the hand and the chest wall. And repeat at the rate of 100 to 120 per minute. The rate of chest compression should be about 100 to 120 per minute. Yeah, shouldn't be too slow, should not be too fast. After 30 compressions, yeah. So how many compressions? 30 compressions. Yeah, you keep counting 30 compressions, and then you give the rescue breaths. Okay. So this is the second part. Second part is chest compression. Yeah. All of you know how to do the chest compression. Now, in the exam, you got to make sure that the medical students all understand. How do you make sure?
Am I clear? Is it alright?
Make them do it. Okay. Now, what I advise is, I told you to divide the BLS into 3 parts. First thing is checking everything. Yeah, checking. I told you airway, breathing, all that, calling for help. There's the first part. Don't ask the medical student to repeat it because we don't have time in the exam. But the second part, chest compression. Third part is rescue breath. After the second part, the chest compression, ask the medical student, can you please repeat what I said? Okay, so then he will do, yeah, and usually he will do some mistakes. What do you do? Correct it. Okay, so then you go to the rescue breath. What if he done everything right? What do you tell them? Excellent, great. Okay, so then you go to the rescue breath. So is it praising is important then?
Yeah, sure.
Very important. Okay, so then open the airway again using head and tilt, chin lift, and give 2 rescue breaths. Yeah, head tilt, chin lift, 2 breaths. Pinch the softer part of the nose, closed, using the index finger and the thumb of the other hand over the forehead. Yeah. Allow the mouth to open, but maintain chin lift. When you maintain chin lift, what happens usually when you chin lift, the mouth will close. So what do you need to do? I'll open it. Chin lift, but maintain open the mouth. Open the mouth and allow the mouth to open, but maintain chin lift. Take a normal breath and place your lips around his mouth, making sure that you have a good seal. Okay, take a normal breath. You don't need to take a deep breath and then blow. So just take a normal breath and place your lips around his mouth and make sure that you have a good seal. But imagine if you do that, then you have to tell the medical student to do it. No. Do you think he's going to do that? No. Nah, what do you do? Clean it. In exam, what is this? What is this? This is a face shield. You have the perforation there. Take one piece. This is for you, and take one more for the student. Yeah. So this is like a face shield. You need to put it on the face and use it. Can you see like a mesh? So that you put on the mouth and then you blow through that. So don't directly touch your face of the mannequin face there. Okay. Now usually it will be written like this side up. It's written this side up. Okay. What you can read properly, that will be up, because if you read from the other side, you can't read it. If you can read this side up, that's up. So that you keep it like that. Yeah, mesh on the mouth. And last time they peeled off this the mesh. If you peel off the mesh, it becomes a hole there. Then there's no point using this. Okay, so you need to keep it there. And then yes, as I told you, head tilt, chin lift, pinch the nose. Don't forget to pinch the nose and take a normal breath. Keep your mouth, make a tight seal, and blow. Okay, have a good seal. Blow steadily into the mouth while watching for the chest to raise, taking about 1 second as in normal breathing. This is the effective rescue breath. That means when you blow, what should be the speed when you're blowing? 1 second. Okay, and where do you keep looking when you're blowing? Keep looking at the chest, and the chest should raise. Yeah, make sure the chest raises. So I don't know. Well,
Pneumothorax.
Yeah. Yeah, make sure the chest raises and maintain head tilt and chin lift. Take your mouth away from the victim and watch for the chest to fall as the air comes out. Yeah, so that means you don't press it for the air to come out. So take another normal breath and blow into the victim's mouth once more to achieve a total of 2 effective rescue breaths. So how many rescue breaths? 2. And do not interrupt compressions by more than 10 seconds to deliver 2 breaths. That means 2 breaths should be within how much time? 10 seconds maximum. So then return your hands without delay to the correct position on the sternum and give further chest compression. Continue the chest compression and the rescue breath at the ratio of 30:2. Okay, then you continue 30:2, 30:2. Okay, so once you explain the chest, the rescue breath, what do you do? Once you explain, can you please show me now? I will do that. So don't use this. So he has to use another one. So then tell him, make him do it. And if there's any mistake, correct that. So then the last thing, what are you going to tell him? Do not enter recitation until the victim shows signs of life, like moving, opening eyes, or breathing normally. The help arrives, or you become exhausted. So that means until when he should keep doing the CPR, the BLS? Until the patient shows signs of life, either moving or talking or breathing like that, or until help arrives. But imagine the help is not arriving until you're completely exhausted. So try to keep doing the BLS, okay? So do you follow me? Can you please show me how you do that? Correct if he does any mistake, yeah? So as I told you, divide the CPR into 3 parts. Now, in the exam, don't talk everything like what I said because you don't get time. So you need to be shorter, clearer, and then explain, demonstrate, and then make him do that. So tell him all this. Do you want to learn BLS and all these? Yes. Okay, let me teach you. You know, let me teach you on the mannequin here. And imagine this is a person lying on the floor, on the ground, maybe outside the hospital or inside the hospital. But before you approach, make sure the area is safe. And if at all, if you feel the patient not in a safe area, first you move into the safe area. Then approach and check whether the person is responding. Ask him, hello, are you right? Are you right? If the patient is not responding, then you have to check his airway and then the breathing. Okay, so for the checking the airway, you do a head tilt and chin lift. With the left hand, keep a hand over the forehead and keep it 2 fingers, the right hand over under the chin, and lift his head and open his mouth. Check is there anything obstructing the mouth. Is it removed carefully without pushing it down. And then you check for the breathing. For that, you need to do look, listen, and feel for breathing. For that, you bend down, keep a chin near to the patient victim's mouth there, and look at and keep your finger over the carotid pulse over the neck. Keep checking the chest wall movement when the patient is breathing for 10 seconds, and listen whether you can hear the breath sound and can you feel the breath hitting on your cheeks. Same time, check for the pulse that you should be doing for 10 seconds. And if you feel the patient is not breathing normally, you should call for help. If you're in the hospital, you call the cardiac test team. If you're outside, you call the ambulance. Are you following me so far? Yes, thank you. Don't ask me to repeat, no time. Okay, now I'm going to teach you how to do the BLS. That's the chest compression and then the rescue breath. I'll teach you how to do the BLS. So first of all, do the chest compression. Kneel down near to the patient and keep your heel. Don't say everything what is there in the handout. Keep it a bit shorter. Keep the one hand, the heel of the hand on the middle of the chest, lower part of the chest. Keep the other hand or this hand and interlock your fingers. Keep your fingers away from the chest wall and make sure your elbow is straight and locked and the shoulders straight onto the patient. And then you compress the chest about 5 to 6 centimeters depth, and you keep doing that at the rate of 100 per minute, 100 to 120 per minute. Okay, like this. Can you see? 1, 2, 3, 4, 5. You have to keep doing that. Do you follow me? Yes. Can you please show me how you're going to do that? So then if it's done it right, excellent. Now let me show you how to do that. Giving the rescue breath. For that, you need to do a head tilt, chin lift the same way as I explained to you that time. And Here in this case we can use a mouth shield, face shield, put the sheet there, and lift the chin and pinch the nose, lift the chin, open the mouth, take a normal breath, and then keep your mouth over the victim's mouth, make sure that there's a tight seal, and blow him. Blow, when you're blowing, it should be about 1 second, at the speed of 1 second, and at the same time keep watching for the chest raise. Make sure the chest is raising, keep looking at that, and then you leave then you take your mouth away, then the chest wall will go down, it recoil, then give the second rescue breath. Everything should be done within 10 seconds. Okay, so can you follow me? Okay, now you do that. Can you see this how you do that? Can you show me? So do that. Okay, then after that, excellent. Now you have to keep continuously doing this BLS until the patient will sign the life or help arise, or if you get completely exhausted. Do you follow me? Thank you. Okay, and how do you feel? Are you happy with that? Yes, good. Okay, so that's how you do the station. So as I told you, make sure that you are very friendly to him. Don't act like a boss here. So make sure everything, if you do that, you still should get 9, 10, but some people are getting, as I told you, low score. That's mainly because one is a time problem. It's not always because they are not good to the student. Most of the time it's time problem. As I told you, the first part, don't ask him to repeat, only the chest compression, the rescue breath. And what I would advise, don't try to finish teaching everything and then you tell the medicals to do it, which is not good. So stepwise, yeah, first part, chest compression, teach, do it. Then rescue breath, teach, do it. Because imagine you did the chest compression, you made the student do it, and then when you start teaching the rescue breath, 8th minute bell rings. At least the examiner knows that you know how to check for understanding. But imagine you taught everything, chest compression, rescue breath, everything. Then you tell the medical, can you do that now? By the time the 8th minute bell rings, you did not check properly. That's the reason I'm telling you, at least go in stepwise, chest compression, make him do it, then rescue breath will do it. And this what happened last time, the lady doctor, she taught everything, whole the chest compression, rescue breath, then asked him, can you please repeat whatever I said? Then he started from, okay, I will make sure the area safety approach, he started from there. So then he was, time was running out. So she couldn't tell him to stop it. So that's the problem. And she got only 4 or 5 marks in the station. So that's the reason I'm telling you, that first part, don't tell the medical student to do it, because you don't get time in the exam.
Just the compressions and the rest of it.
Yeah, that's what I would advise. Okay, so practice the station well. If you do the station well, you will still get a very high score. I've seen people getting high score. But remember, if you don't do well, if you're not friendly, you will score less mark in the station. This is one of the problem station in the exam. But again, as I told you, if you do well, you will still get high score. Okay, so any questions here?
I have a question.
Yeah.
Okay. You said the chest compression should be 100 something in 1 minute.
Yeah.
So how do you reconcile it with